and the last question was on page 8, and you go into school funding, and I'm just wondering how much is in the general fund that are Prop 98 type expenses that we're paying with non-Prop 98 funds, like this ballot measure that we're looking at for November. That's going to be paid out of the general fund by non-Prop 98 funds, and the governor was even polite to mention that during his press conference. I think he used a number of like $500 million a year. So I'm wondering, why is that being put upon the other taxpayers as opposed to just being taken out of Prop 98 funding?
Yes, the school bond that is slated to be on the ballot this year is for $9 billion, and our office estimates is that that would eventually cost the state $500 million a year in debt service. Historically, GO bonds have been funded even for school infrastructure on the non-98 side, but that is an increased cost, and I think the shortcomings of the current school facilities program have been well documented by our office and discussed at length and committees over the last year, and we continue to have the same concerns about funneling more money into the existing system that's very state-centric and cumbersome, and also does not get the funds to the schools that need them the most for infrastructure upgrades. So we would like to see additional reforms to the system.
Well, you're going to see a real tight squeeze in a few years between your pension cost increases, which have gone up quite a bit this year, and then your retiree medical, and now school bonds. And, I don't even know how much you're paying out of the non-Prop 98 for CalSTRS. So that's going to squeeze you even more. And I'm just wondering how we could try and reclassify some of those expenditures so we could free it up for other programs that everyone's looking at. So with that, Mr. Chair, thank you. I guess one last question. On page 8 of your report, Mr. Taylor, you refer to the MCO tax proceeds as uncommitted, which, how do you commit it? I mean, why raise a tax if it's just uncommitted?
Well, that's probably better answered by the administration. I think they have a proposal that they say will raise a certain amount of money. They do commit in the budget a portion, a very small portion of that to IHSS. The rest they've just sort of left open, and so we just wanted to make sure it was clear that under the governor's proposal, they assume that you have these proceeds, and yet there's nothing that they sort of have designated for at this time.
Okay, thank you. Thank you, Mr. Chair.
Thank you, Senator Morlock. We have Senator Monning, followed by Senators Mitchell, Wynn, and Hancock.
Thank you, Mr. Chair. And actually, my question follows up on Senator Morlock's last question. I do want to thank the chair for the framing in some of your questions focused on the developmentally disabled, and also thank your staff for the excellent work. Looking at the staff, the budget committee staff at page 26, with reference to the MCO tax, an anticipated allocation to restore the 7% cut in in-home support services. And then it says the administration notes its expectation that any additional targeted rate increases for services and supports to persons with developmental disabilities above what is proposed in the budget would be funded by the MCO revenue. Is that still the administration's goal for allocation of some of the MCO tax?
So our proposal through the restructuring and reform of the healthcare industry was to provide, would generate $1.3 billion in revenues for the state. Our proposal was to dedicate a portion of those, about $250 million, to restoring the 7% for IHSS. I think we recognize that the legislature may have different priorities for restoration, and so that's a conversation we hope to continue to have with the legislature.
But at this point, that is an accurate characterization of the administration's thought of a possible allocation, at least for some portion of the MCO tax
Yes.
on developmentally disabled. And then Senator Roth asked my earlier question that I think Ms. Bosler responded to, but I'd like to hear Mr. Taylor's response on the administration's proposing to put in an additional $2 billion, other than that, as you just described, required by Prop 2 into the rainy day reserve. And you've perhaps addressed this, but it would be helpful, just your sense from the LAO perspective of that commitment of non-mandatory contribution to the rainy day fund versus either some or all of that going into a discretionary fund that could give the administration and the legislature a little more flexibility in dealing with unknown, unanticipated changes in revenue.
Sure. And we have talked about this, but maybe I can sort of take another cut at it. Proposition 2 required, and the budget reflects, an additional $2.6 billion that goes into the BSA by formula. And what the administration has done is proposing to add another $2 billion to the BSA. It also proposes to increase the amount of your reserves, your free reserves, your SFEU reserves, by $1.1 billion. So I think it's really important to take into account both reserves, think about the total that you want to set aside, and in some ways that's the most important issue. That's much more important. Now, how it's divided up between the two, there are implications for you, and what we've suggested is, it's not an unreasonable proposal the governor's making, but that when you put the money in on your own, it's now subject to the rules of Proposition 2, which you have no control over. So that if you want to have the same reserve level as the governor, we would at this point, I think, suggest that you put that $2 billion in your SFEU, see how things develop. Maybe you have to make many more contributions under Prop 2 to the BSA once you get to May. Maybe by next year you've capped out on your 10%. And think about that. If you have more monies that come in next year, you would have to spend those on infrastructure. Well, that may be a good thing. What does that suggest about your spending on infrastructure in 16-17? All of these propositions has made your budget decision-making much more complex. And I think all we're suggesting is at this time, just be cautious about unnecessarily tying your hands. Again, not that it's an unreasonable proposal, but we would tend to be cautious about doing so.
I think that does underscore my concern, and you framed it as you do in a very diplomatic way of exercising caution. Would it be your recommendation to the legislature that it may not be prudent to allocate a full $2 billion to the rainy day fund, above the 2.6 that's required?
Again, I think that's what we're suggesting, Senator, recommending at this time, but that doesn't speak to what you should do with the two. For example, you may have different priorities either on spending it on one time or ongoing, whereas I think you should give very high priority to establishing as large a reserve as you feel you can. You're at about 8.5%, 9% in total reserves. You're getting towards the end of a recovery period. So what we've suggested is have a robust reserve target, as high as you feel you can accommodate with all the other needs that you have, and get there either this year or relatively soon.
Thank you. I appreciate that. And again, I think what I hear is the importance of being cautious and putting as much in reserve as possible. But as the chair pointed out, when we look retrospectively of how various programs were impacted during the recession, that have not necessarily been restored or restored to a level commensurate with increasing costs, that this is an area that I think the legislature needs to be very careful in determining, are we really in a position to lock with a key an additional $2 billion versus that being obviously subject to our deliberations and negotiation with the administration. But thank you both for the clarifications.
And if I could just quickly add, when you get to May, the May revision, we see what the revenues were in April, how much more you may, if it's more, may be required to put into the BSA. That could change your calculus also.
Great. Thank you very much. Thank you, Mr. Chair.
Thank you, Senator Monning. Senator Mitchell.
Thank you very much, Mr. Chair. Like Senator Wolk said earlier, we'll have plenty of opportunity once the season kicks into high gear through the subcommittee process to go in depth in some of these issues. So I'm clear that in sub 3 we'll have further opportunity to talk about health, MCO tax, Department of Developmental Services, child care. So for purposes of today, I just really want to ask two questions, one focusing on SSI, SSP, and your proposed investment there, and a question about your apparent lack of suggested additional investment in the CalWORKS program. You know, I have to start by saying, as I look at your presentation, that I'm reminded of the fact that words are very powerful. And when I see strong verbs and adjectives used to describe investment and you want to strengthen and address and increase, and yet the one slide focusing on poverty talks about countering the effects. It's such a passive word. And I am clear that the administration clearly believes that what you listed here on the slide will counter the effects. I am also clear that based on my experience and based on the testimony we hear in sub 3 every day, that it's simply not enough. And that's where we'll have to continue our conversations as a legislature with the administration to come up with the use of stronger words like strengthen families, invest, when it comes to the issue around poverty. Let me start with SSI, SSP, if I may. Because I want to make sure that I'm clear about what the proposal really does. I have been under the impression that the proposed increase was an increase to the basic grant. But as I heard you today, you referenced it being a COLA. I understand on the SSI side of the equation, Social Security Administration has a COLA every year. And so I want to understand fundamentally in real dollars what it is we're doing, if it's a COLA, if we're looking at an increase annually. I'd like to know how you decided on the amount of the increase, which I'm looking at being $4.67 per month on the SSP side. Correct me if I'm wrong on that. And at what level do you believe this proposed increase will put the SSI, SSP grant levels in terms of the federal poverty level?
SSI, SSP, there's 1.3 million recipients of this important safety net grant program. The federal government does generally provide an annual COLA that is implemented January 1 of each year. Last year, there was actually no COLA provided. This year, there's a projected COLA of 1.7%, and that would be on the federal, the SSI portion of the grant. The state's COLA, which is at 2.96%, which is applied to the SSP portion of the grant, would also go into effect January 1. This would increase the monthly checks to individuals by $17 and the checks for couples to $31 respectively in January 2017.
$17 is based on the state's increase, or it's combined with what the feds would be doing, whether we included an increase or not?
Combined.
So what's the state's contribution to
I don't have that breakdown right now in front of me. It is my understanding, it's about $150 million general fund contribution at the full year effect. So half year, it's about $75-80 million.
Okay. And can you answer the question about what the actual state contribution is toward the 17 total? If not, just know that that's information I'd love as we begin our subcommittee hearing process. And with regard to the federal poverty level, do you know at what level that now leaves our aged, blind, disabled segment of our communities?
Senator, the information I have is that the individual maximum grant was at 91%, and the couples was at 113%.
Got it.
I think that's before the grant, but I just have to check on that.
Okay, all right. Okay. And then before I get to CalWORks, one more question, because it triggered my memory as we talk about this federal action, state action, and how we really separate the two. The feds took very aggressive action with regard to the Child Care Development Block Grant, CCDBG. And I want to know the administration's kind of plan and expectation, because I don't see any early care and education changes or investments to bring us in compliance with the new federal expectations around CCDBG allocation and program kind of management. What do you-
Yes, since the new Child Development Block Grant was passed, we've been working behind the scenes with the Department of Education and the stakeholders in the community on how we are going to implement the changes that are extensive, as you note. And so this work continues. There are no specific proposals in the budget that relate to it, but it is work that continues as we look at the way the monies that are currently dedicated to quality are spent, and how we will be increasing those over time. So it's a work in progress and something we continue to look at. Last year, there were also 2 task forces that were put in place to also look at streamlining and improving the administration of the child care programs, and those work groups are also going, and we expect to bring back recommendations for you later in the spring.
Which we would then see reflected in May Revise or through?
That is highly likely.
Excellent. I just wanted to make sure that we weren't just telling the feds, take a flying leap or something. Okay. And my last question, Mr. Chair, deals with a short-term safety net program designed to help families keep their children out of deep poverty. I'll restate short-term, in this state now, 24 months, and that's the CalWORks program. We're all clear that there are about 1 million California children whose families are so low income that they qualify for CalWORks. We are clear and have heard repeatedly what the average grant is, which today is about at 42% of the federal poverty level, and I have no idea what it would be if you counted it using the supplemental poverty measure. I would be afraid to even know what that percentage was. Your 8 pages highlight poverty as an issue in the state. Again, your Countering the Effects of Poverty one-pager identifies areas in which you feel you're making a difference, and yet a program that is a government temporary support program designed to keep children out of poverty, you are completely silent. And I'm curious, given the number of California children who are living in poverty and deep poverty, how you justify that.
The CalWORks program is absolutely a fundamental and important baseline program that's provided to those that are in the deepest poverty. And there have been targeted investments that we've worked together with the legislature on over the last few years. One that comes to mind that I think has been very important is the CalWORks Rapid Rehousing investment. This was something that was implemented last year. And there are these types of additional enhancements to the core program. Also, during the recession, when the program was restructured, there was really renewed focus at the county welfare offices and really getting people in and into a program so that they could get back to work as quickly as possible. And also to realize that there were, in some cases, there were going to be barriers to work that needed to be removed, and that investments would be made there. So there is not that there isn't a lack of attention on the program. The program is very important. The working of the program is really important. What counties and county workers are able to provide individuals who do have to come into the program so that they can be trained for a new career or get back onto their feet, stabilize their family. These are all really important things and things that the Department of Social Services continues to be in constant conversation with the counties to improve. So it's an absence that it was not mentioned. There wasn't any big changes that we're proposing in this budget.
Additional investment.
Or additional investments are not proposed in the January budget. But we understand that this is going to be a conversation as we work through the spring and craft the 2016-17 budget. So we fully expect that we will continue to have those conversations with you.
I'm thrilled to know that you have that expectation. So do I, because I appreciate the changes in programs and investments that you just referenced, but none of them are reflected in the January 2016 version of the governor's budget. And so when I ask the question, how do you justify no additional continued investment, it's based on the reality of the number of children who are still living in a program that is not providing enough resources to meet their basic needs. It is at 42% of the federal poverty level. We just heard a equally as deserving critical program, SSI SSP, has received investment that we assume brought it to 90 and over 100% for individuals and couples. And so I'll continue to ask those questions and look forward to the opportunity to continue to influence the outcome. Thank you, Mr. Chair.
I count on that, too. Thank you, Senator Mitchell. We have Senator Nguyen, and then Senator Hancock and Senator Pan, and we do want to leave a little time, of course, for public comment and also for members to be able to probably have a little something to eat before session. So Senator Nguyen.
Thank you, Mr. Chair. I have some comments. I have some different questions for both of you or individually as well. First, I want to, thank the governor and the administration for the additional $2 billion for the rainy day funds. But, hearing all the questions, I know there's a lot more work to be done on how and which pocket we put that in, whether we call it rainy day or not, or somewhere else. So really appreciate, though, that we are putting more money than we need to, which is the right thing to do to make sure that we have enough reserve and a little more. Because in emergency, you always want to be more than just enough. My next comment is I do want to thank the administration for the additional funding for SSI and SSP. There's so many individuals out there who, $800 a month is not enough to even pay for rent. And so the additional funding is definitely appreciated by a lot of these families. A lot of them have, obviously they're disabled or they're seniors, and so greatly appreciate that. I know from hearing from last year, that it's a bipartisan view that we would like to restore the Medi-Cal rates increase for providers. And, I'm looking at what the administration is proposing, one that really caught my attention, and I think, because my understanding last year was estimated between like $250 million if we were to do the medical provider rates restoration. It's around roughly that amount of money. You have here, which concerns me, is the budget this year includes an additional $169.9 million for county workers to conduct Medi-Cal eligibility work on behalf of the state as a result of the increase in Medi-Cal casework since the implementation of the ACA and the delays in the automating the eligibility process. From my work, when I was at the county, that was such a big problem, and that's well over 2 years ago. Now we're putting almost $200 million into adding more staff because our automated system is not working. That $200 million could easily go to the provider rates increase. When is this delay going to stop? When is this system going to be up and running? And why isn't this money put into direct services versus adding more staff because our computer system's not working?
So implementing healthcare reform, as been said already today, was a major undertaking, and certainly the information technology component of it as well. This was a system that, for all intents and purposes, is absolutely working, but there continue to be workarounds with the counties and their 3 consortia systems, the SAWS systems, that we continue to have to work through. It's difficult by itself to stand up one information technology system by itself. This one has to talk to 3 other county systems, which are the base eligibility systems, and interact with countless other systems as well. So this is a complicated transaction. We have internally a roadmap for implementing additional changes to get the functionality into the system, but there are a lot of changes that continue to need to be made to the system. This includes additional changes by the federal government, other priorities that have been discussed in the legislature, and so these staff are really critical, and it's not an increase over, that full amount is not an increase over the current year level, but a continuation of existing resources and recognition that we just don't have all of it working the way it was envisioned. And we continue to work with our county partners closely on moving towards a system that is more automated and requires fewer man-hours in offices. But for right now, it's very important that we have those warm bodies that are touching files and understanding people's cases and getting them enrolled into the program if they're eligible. So that investment is important. One thing I wanted to say on rates is that California is really unique, and I think the rest of the United States is following, in that we have a lot of our lives in managed care. And with managed care, there really is a different funding system for providers. These rates that we provide to managed care plans are actuarially based. That means they're actually based on the costs of providing the care. And so these rates are adjusted annually. They've been going up annually. So there are automatic adjustments for those rates already built into the budget. Certainly, we do still have many individuals in fee-for-service, and those rates have not been increased except for in targeted circumstances where access was determined to be a problem. And the Department of Healthcare Services does continue to evaluate issues as they come up and understand what targeted rate increases are needed from an access perspective.